most areas of the United States, where there's 3 or perhaps 4 seasons, the most common triggers are pollen. Largely February, March, depending where you are each year. Tree pollen. There's early, mid, and late tree pollens. Following tree pollen is grass pollen. That usually comes around the Easter time period in most places, followed by early weed pollens, and finally, late summer and early fall, ragweed pollen, a big culprit in the late summer, early fall. The pollen count is a measurement of pollen levels in your area, and it's done outdoors, and a pollen counting device will count certain pollens, and there's a certain criteria, low, medium, and high. And the National Allergy Bureau of the American Academy of Allergy, Asthma, and Immunology has pollen counting stations throughout the country, and you can go online and understand what the pollen counts are for your community. Pollen counts increase when it's windy. Windy is not the friend of the allergy sufferer. When it's sunny, it's dry. Those are conditions when pollen levels typically rise. The opposite, when it's wet, drizzly, cloudy, windless days, those are days where pollen counts typically are lower. But again, every pollen is different and every day is different. So when it's a high pollen count day and you know your pollen is prevalent, for example, birch pollen, oak pollen, and so forth, you might want to exercise indoors. You might want to pre-treat before you're exercising going outdoors with antihistamines, oral antihistamines, nasal steroid sprays, eye drops, and things that you know work. You also want to understand that there are other things you can do. You can wear a hat, you can avoid hair gel, you can wash your glasses and face off after coming in from the great outdoors. There may be some days you perhaps would rather schedule, perhaps when it's not windy, and days where it's moist and a little drizzly could be better for gardening in an individual that has extreme sensitivities. So paying attention to the weather report is the first thing to think about whether to take your medications and pre-treat.